The use of ozone therapy in treating venous ulcers, diabetic foot ulcers. Hi there, my name is Dr. Walter Lamo, naturopathic physician with a practice solely focused in cancer care. There was a paper that was published out of Italy in June of 2025, and it was a non-randomized trial, but they were looking at 25 patients where they had really bad ulcers in the lower leg, and they were kind of more the worst of the worst. And we know, obviously, in groups of patients, if things of those aren't treated, there's amputation. And what they did is they use of ozone therapy. So what basically ozone is electrified oxygen. It's something that we've been using for many decades, and they treated them with when you say ozone therapy, there's ways of using it, where they're using it in the blood, where you're grabbing blood and you're ozonating it, oxygenating it. You're putting, say, this bag around the affected area in the lower limb, and you're putting the ozone gas through that and bathing the area. You're also could be injecting around the area. And what ozone does is many things. It kills bugs. So they noticed in the study that there was no signs of active infection following. So it can kill a diverse group of microbial agents. It's an oxygenating agent, so oxygen is important to heal, and it stimulates the immune system in a bunch of healing. So anyways, when you're looking at the highlights of the paper, I'm just reading this on the screen. 25 patients, severe venous leg ulcers, diabetic ulcers, unresponsive to conventional treatment. In terms of efficacy, 80% of patients achieved complete wound healing, 80%. And pain scores went down. 92% of septic wounds had negative bacterial cultures after treatment. So, and inflammatory markers like C-reactive protein, interleukin 6, etc., all went down, and there was no adverse events, and more importantly, there was no amputation. So this kind of information is important for people to be aware of. I remember years ago, there was a time when ozone therapy was going to be provided at Vancouver General Hospital. This is many decades ago from the work of Dr. Roger Rogers. And the reason for that, there was a patient who was going to have his leg amputated from diabetes, and the use of ozone therapy spared his leg. And so this prompted this movement. Unfortunately, things didn't move any further than that, but it's a very simple treatment. It's not complicated. It's not high cost. Yes, you need facilities to administer it and to use this approach, but from an actual perspective, it's just electrified oxygen, which is obviously pretty cheap otherwise. So I think it's important for people to be aware of this information. Yes, more research is needed. Yes, it's considered experimental, and yes, it needs to be randomized and all that kind of thing. But nonetheless, we've definitely seen groups of patients where it's been valuable for them.